Hello everyone, this is Dr. Naina. Welcome to my show, NainaMD Beverly Hills, Fusion of Science and Beauty. As you know, my ambition and my passion is to get anti-aging and regenerative medicine into an evidence-based specialty. It is now, and we continue to show you and bring you guests that will actually tell you so many topics that have to do with anti-aging and regenerative medicine, but in a little different way, in a little different manner. So today I've got a fabulous guest. Her name is Anat Rofeh. She's been a dietitian, clinical nutritionist for over 15 years. She's one of the leading dietitians here in Beverly Hills, and she is phenomenal. I really want to introduce her to you. She has a clinical degree in dietetics and also in nutrition. Again, welcome to my show. I really thank you for coming on to my show.
Thank you so much. Thank you. It's an honor to be here.
Absolutely. I'm so glad that you were able to make it because we have so much to talk about today. As you know, there are so much that's going on with the food and nutrition industry. We are in a period of time where certain claims that we're even making on foods and nutrition and supplements is being questioned. It's even being questioned by the FDA. And I can well understand some of their concerns, but at the same time, I don't want to underpower or undermine the power of nutrition. Because this is something you've done for over 15 years and you know what nutrition can do. So claims or no claims, I think we really need to discuss. I think that's just a matter of semantics, and if people want to really get into that issue about and really make this whole nutrition and taking care of yourself into a battle of how you say it and the context, that's pretty sad. Really, it's pretty sad. And if you really want to open yourselves up to a world of seeing how nutrition has played an important role, in fact a critical role, in the prevention of certain diseases, realizing, we're going to open up the topic right into diabetes, which, as we know, right, Anat?
Correct.
It's in epidemic proportions.
Exactly.
We also know that 85% of diabetes can be lifestyle and diet managed, correct?
Correct.
Okay.
Exactly.
So tell us about what you have learned in your experience, in diabetes, and then we'll kind of just tell the audience what we think. Again, I don't think that the show and the critique should be centered on how the context of what we say. I think it should be based on you guys look at how much nutrition and certain nutrients can help with diabetes, right?
Exactly, correct. So diabetes is a prime example of how nutrition is very important in prevention and treatment of the disease. And one of the important things is that physicians actually consult with us as the dietitians.
Yeah.
And they look up to us in terms of making recommendations. We look at the patient's lab values. We look at medications. And some things, obviously, we have no control over, your genetic makeup. But what we have control over is your diet and exercise. And a lot of diabetics, when they first get diagnosed, they're scared because they think they cannot eat anything. They don't even know what they can and cannot eat. And my role is kind of ease them into the transition and knowing also that they can actually have, through modified lifestyle, they can actually eat almost everything.
There you go. That's the key thing. Thank you so much for saying that, because it's just been known that, diabetics can't eat sugar. Well, nobody discusses in proportion. You can have a little bit of sugar to pay. So there's something known as a glycemic diet, but then there's something known as a glycemic index diet, right? Based on portions and based on your body weight and your height and all these kind of things. And also there's something known in terms of the diabetes is that if in Pritikin, what he did, and a very good friend of mine, that's Dr. Nick Delgado, he talks about this because he used to be the leading person at the Pritikin Center, leading nutritionist there, and he said that they looked at where diabetics were fed if you just had like a normal diet, right? And then you were given rice, let's say, which is the worst thing supposedly to give a person with diabetes. Well, yes, their blood sugar spiked. It was horrible. okay, because the insulin receptors were not sensitized. Now, for about 6 weeks or 6 to 8 weeks, they gave them amazing, just the right kind of diet where it was like the good kind of fats, the good kind of carbs, the good kinds of proteins, the proper kind proportions and all of that. So it gave time for the insulin receptors to be, so to speak, sensitized, right? Then they gave them the bowl of rice and the blood sugars didn't spike as much.
Correct.
So what does that tell you?
So obviously we know that when patients actually start following a good diet, a balanced diet, portion control, they lose the weight. Actually the fat cells become sensitized to the insulin.
Yes.
So, and therefore a lot of times they also can reduce the need for medications. So that is a prime example of how nutrition is important in treating diseases such as diabetes.
Yes. What do you think is like, everyone talks about like cinnamon, right? Cinnamon. I always tell, add cinnamon in your rice, add cinnamon in your meats anywhere, right? The cinnamon sticks and cinnamon powder you can actually put. I actually put cinnamon powder on my, like, if I take any kind of juice, I'll just sprinkle it with cinnamon. I mean, I know it sounds kind of strange, but it tastes actually pretty good. But are there any other nutrients that are good that you know, just in your experience? So we're not making any claims, but we're just saying, you know, in your experience as a dietitian, what have you found to be helpful for patients with diabetes?
So some of the nutrients that I find to be helpful, whether patients report back to me or obviously some things that are scientifically we studied, will be, for example, garlic. I know that lowers blood sugars, but at the same time, patients need to be careful if they're on medications. Yes. So there's no food-drug interaction. So it's very important to communicate with your physician, your dietitian, what other medications you're taking, what herbals you're taking, so we can actually manage it properly. Yeah. Yes. Also, it's very important to have a balanced diet. We need, like as you said, the healthy fats. We need the protein and fiber to balance the blood sugars, because if we only eat sugar and carbs, we get the spikes, the highs and the lows. So therefore, like having a very balanced diet with lots of vegetables, leafy green vegetables.
Because of the fibers
the
and
fiber.
Yeah.
Exactly. Yeah. And fat takes longer to digest. Protein also takes longer to digest. So it's very important to have a balanced diet, just like the plate as we discussed, where we have a little bit of each food group. Yeah. So I think that's kind of a very basic concept. And then obviously if patients come up with like different herbs they want to take and things that I've heard of, I review it. And I will definitely like educate them if it's okay, if there's any contraindications with the medications that they're taking. Yeah. And if it does no harm, then that's fine.
Yeah. Let me I'm going to just, it's on the side. Let's just say, for example, a person is on a blood thinner. Yes. Okay, let's just say that, because a lot of our older population is on blood thinners. Correct. Or let's just say they're on aspirin and it's going to thin the blood. Okay, and let's just say that we give them, and even a pharmaceutical company has marketed Lovaza, which is a fish oil, right? Mm-hmm. We know that fish oil thins the blood. Correct. Right? So let's just say we know that fish oils have many benefits, right? That they decrease inflammation. Of course, we don't want to overdo it, but in the right proportion, that they can have many benefits, all right? So let's just say that patient has a blood thinner, and we know that they may have a drug interaction. Rather than simply stopping the fish oil, why not monitor, and they can go back to their doctor and say, hey, check my blood work, because how do I know that if I thin the blood with this fish oil additive, then maybe my medication, right? My blood thinner medication may need to be decreased. Exactly. Tell me, is that a bad thing? And that's the kind of logic that I'm not understanding. Rather than just being a blunt said, oh my gosh, blood thinners and this thing you can never take. I mean, yes, that's a great statement to make when you're going to just simply send that patient out and you're never going to hear back from him, and you're never going to see him in like 2 years, he's going to be without a blood test. I don't think so. I think patients who are generally on these kind of medications are going to be monitored at least, quite frequently. And if they were to add some nutrient that might benefit them, what's the harm in having them being tested more frequently till it stabilizes to that new level, so to speak, and that interaction, not every interaction may be a negative interaction, but it needs to be a more monitored interaction and stabilized, correct?
Absolutely.
And I think that's a very important point to make, because what really is the harm? Or let's just say you take a lot of antioxidants, the proper kind, again, for that particular person. Well, they're going to lower your inflammation, but anybody who's on a high antioxidant diet, they're going to have thin blood. Just because most antioxidants thin the blood.
Right.
I mean, so really, what's the harm, again, if you're taking it with a medication, but yet go get monitored and go get tested instead of having it tested every 3 weeks or every 3 months. Maybe for a while you might have to do it every 2 weeks just to see where this thing stabilizes, and then you can move forward, right?
I that will actually also make logical sense to me, and that's the key, having the physician who is more open-minded and is willing to listen to the patient and their needs and customize the medications and the supplements the patient wants to take, and be able to customize everything to each individual, because we're not all a cookie cutter. You can't do a cookie cutter.
And that's what we're realizing. We really are personal, and this is where functional medicine and the kind of medicine that I do is integrative medicine. And right now we're having a dilemma, even as us integrative physicians. We don't come under a scope. We don't know what scope, because I'm really not an internist, although I've been trained as an internist. I have a couple of years of surgery, so I'm really not a surgeon. I'm really not a endocrinologist. I'm really not this, but yet I know so much about all of these other things. And so I'm a nutrigenomics expert. I'm this, I'm that. So I don't fit really into a standard scope of practice. Therefore, we're very subject to being attacked. And then it cuts into when you're saying ask your physician to be more open-minded. How are they open-minded when they're actually intimidated not to make those recommendations because they're afraid that they're outside their scope? Right. So there's a real dilemma going on in that we're recognizing the power of nutrients. We absolutely going to have to rely on people like you, because really a lot of doctors are not educated, or are they sure of themselves, or nor do they want to venture out into that arena because of just being intimidated from the state medical boards.
Correct.
So I think that's really important. I just wanted to emphasize that. I really wish physicians would be open-minded, but sometimes they have limitations in defense of them. They really have their limitations. Exactly. So we need to educate, right? Exactly. Educate and awareness. So that brings us to the next subject.
And if I can add one more thing, as you mentioned, I think it's very important to have an interdisciplinary approach.
There you go.
Where we have a team, and then I feel the patient also feels safe, that we really care about him.
Yes.
Having a physician like yourself, having a dietitian, and also a pharmacist. So there's a whole team approach. It's actually, we can communicate with each other and educate each other about the medications,
there
about
should be
the herbs.
teams. I think there should be teams when you have a whole game plan. Exactly. That's what we really do. There should be that coordination of care, not just limited to just with the doctor. You should have a whole team that says, okay, this is what we impart, and maybe have an integrated physician, be present that to represent a different viewpoint, because they understand it.
Exactly.
No, absolutely.
Yeah.
So the next big topic is obesity, right? I don't know if it goes hand in hand with the diabetes, because diabetes is epidemically increasing. Obesity is epidemically increasing. You've seen the movie Super Size, right? We're even getting, plane seats are being made bigger. I went to the most amazing hospital in San Diego. I won't tell the name of it, but it was really alarming to me, because I looked at these doors and they said, you know what? We're supersizing the doors because we know that a lot of the medical personnel are gaining weight, and so they're not being able to get through the doors. To where they need to be. So they're supersizing the door width. And that's alarming to me. Mm-hmm. Rather than supersizing everything, why are we not super educating? How about that? That maybe we could super educate, super make people aware.
Right.
And so I think that's a huge issue. I know we're going to go into a break, and let's just think about that for a minute, and we're going to be right back on NainaMD, Fusion of Science and Beauty, right here in Beverly Hills. Be right back. Hello everyone, welcome back to my show. This is NainaMD, Fusion of Science and Beauty, right here in Beverly Hills, and I've got a fabulous guest. She's such an experienced dietitian, one of the leading dietitians in Beverly Hills, if not the topmost. Her name is Anat Rofeh. She is a clinical dietetics in training, clinical nutritionist, and we were just touching back on the subject of obesity, correct?
Yes.
So it's in epidemic proportions. I think obesity needs to be defined as well. It's not, as you know, in the hospitals and all the patients that you consult on, everyone goes by BMI, right? Body mass index, which is, it was actually, 15 years ago, that was a great concept because you had to classify and you have to term obesity and then also the indications for medications, right? That were given at the time for obesity. But it doesn't tell the story. I'm sorry, but that technology is outdated. It's because we have to look at body composition. And let's explain the difference. Body composition is not, so body mass index is dependent just on height and weight. That doesn't make any sense because you could have a football player who could be, let's say by body mass index, he could be obese, but he's only like 10% body fat. So how do you explain that? So we really start to need to look at body composition. And I had this machine, okay? It was the InBody 5 like 15 years ago. And I was questioning, well, what is this doctor doing? What is this machine? And, I had to always defend myself. I had to explain why I'm using this machine. Now I have this one in Beverly Hills. I bought another one. And my daughter tells me, oh, guess what? And obviously we now know that the American Cancer Centers of America are using body composition analysis. They're no longer relying just on body mass index. We also know that UCLA is doing a study on how do you predict, for example, pre-diabetic condition or metabolic syndrome, and they're looking to look at body compositions. There's now article after article starting to emerge on body composition. Mm-hmm. So having said that, we are now looking at body composition, and a lot of times people's body fat is just tremendously high. Even you've got the skinny people, we call them skinny fat, right? Because they don't have the muscle that they need to have. And the number one biomarker of aging is loss of body mass, right, which is sarcopenia. So what do you do? What is the first thing that you do? You've got this is a challenge for you because, if you could make everybody lose weight, you'd be number one worldwide, right?
Right.
So what do you do? What are some of the things you do?
Honestly, I think, as you mentioned, education is the key. And educating the family. It's a family. I think we're obligated to educate the family and start from the young kids because that's the age where you can actually make change. And diet is one of the most important things in preventing obesity because that's basically, it's your intake of calories, empty calories. And we see a lot of obese people right now actually are malnourished because they follow the standard American diet, the SAD diet.
So it's not just, so in other words, it's not just calories, right? You have to take the good. So do you believe in like the age-old thing is just saying, okay, 3,500 calories less and you lose a pound. But what if you're losing a pound of muscle instead of fat, right? It's not just about calories, right? It's about what kind of calories, right? Exactly. What kind of fats, what kind of, right, all of that.
Exactly. The micronutrients as well as the macronutrients, the vitamins,
explain
the minerals.
what those micronutrients, I think, for the audience.
So macronutrients, as we know, is the carbohydrates, proteins, fats, and the micronutrients are the vitamins, the minerals that we get from our fruits and vegetables. So unfortunately, we see a lot of the obese people, they eat McDonald's, for example, or the shakes. There's no nutrition value in there. So a lot of them have actually, we label them as malnourished from within. Wow. They also have inflammatory markers, high CRP. The inflammatory markers are up. And what
are some of the other things that you see metabolically as far as CRP is high? Do you see anything else?
Yes. Syndrome X, high blood pressure.
Which is an inflammatory disease. You know that blood pressure now, for everyone out there, it's inflammatory disease. It's inflammation in the blood vessels that then causes the stiffening of the arteries, and then you end up with high blood pressure.
Right. Fatty liver is another big
I'm seeing this so much. Yeah. We're seeing this so much, right?
Yes.
Fatty liver, we're seeing
Yeah.
A lot.
And basically what happens is when you have the abdominal obesity, that's actually the worst place to have it. And we see that people that have obesity and abdominal obesity, a lot of the fat actually deposits in the organs. So that's why we have the fatty liver.
And also it's called, and then you have the visceral fat. So there's something to know about what we call it. So there's different types of fat distribution, right?
Yeah.
There's a sub-Q fat, which a lot of the dermatologists and the plastic surgeons take out, right? But then there's this visceral fat, which goes around your organs, and it just kind of goes all around. And that's the one that sometimes gets inflammatory.
Right.
It starts attracting. It's like a magnet, and it attracts all these inflammatory, causing things. And so then you get all this inflammation, and it just breeds. So, and a lot of it will collect around the fat, around the abdominal area, right? The stomach area. So,
Exactly.
yeah. So having said that, how do you start? Do you tell them to go on like a multivitamin as a basic thing? Do you tell them, what do you do to that? What's the first thing you tell them besides the education? How do you start to design their diet for them?
Okay, so I always obtain a diet history.
Yeah.
I look at the lifestyle.
Yeah.
So I try to, make changes that are realistic. Because if we're going to make drastic changes, it's going to be really hard for people to follow the diet. So we have to first look at the person and have realistic goals for them. So little changes. If they drink, for example, sodas, Coca-Cola. So I try to tell them, if you like that fuzzy feeling, have club soda, sparkling water. Sprinkle it with a lemon of lemons,
yes,
and put stevia in it to make yourself a diet lemonade. So and right there you can cut 500 calories just right there with having 2 cups of soda a day.
Right.
So it's little changes that that I guide them and I coach them and I hold their hand. So and it's very important to have structure. It's important to follow up.
And converting the different kinds of fats. There are fried French fries, which are bad fats. You convert them to good fats. Say, okay, because we still need fats. You convert them to an avocado or something, right? Yeah.
Exactly.
Yeah.
Exactly.
Yeah.
So basically, as you mentioned, converting and kind of tricking the brain into still be eating
pleasure, like that is clear.
Exactly, because you cannot take that. We're all human beings, but we all have to basically educate and make simple changes that are realistic for the patients.
So I think you're absolutely right. Education is definitely a key aspect.
Yeah.
And do you find that a lot of obese people, because a lot of them will tell me that they exercise, or that they're what do you find? Do you find that that's true or not?
Well,
do you believe that?
It's funny. There was a study that they mentioned that a lot of the obese people underreport what they eat, and the skinny people overreport what they eat. And for example, now I have some patients, and with the iPhone, I can actually see how many steps they take. So I tell them, take out your phone and let me see on the pedometer how many steps you took, and they tell me the exercise. And actually, when you see in the phone like how many steps they took for an average in a week or a month, you actually see they're not even meeting the 10,000 steps.
Wow.
That's our goal.
So they're eating more and they're less inactive in proportion,
yes.
right?
Yeah.
So that's a huge thing.
Yeah.
Let's talk about another subject, allergies. It's just another area that's exploding, food allergies, and especially people, now there's 2 types of allergies, right? The immediate. So you do go and get your skin testing done, right, to certain foods, and you say, well, that's kind of a no-brainer too, because you might find that certain foods you take, like I'm allergic to lobster, I can't breathe when I get, so obviously I'm going to be allergic. But there's a different kind, what we call a delayed food sensitivity reactions, and these are tested by blood. There's good companies that do it. Alcat, Alitest. These are great. Some of the nicer companies that do testing like this. But what it is defining these delayed food sensitivity defines inflammation that starts to happen in the gut. And just tell the audience what you found as a nutritionist, what you find people with these food allergies and these gut issues. How are they related, or what's happening in that?
So a lot of patients report that once they eliminated certain foods, for example, wheat or dairy products, they actually start feeling better, whether it's the gut or headaches. So
a lot of symptoms got better.
Yeah, a lot of symptoms got better. So I always try to tell clients, give me the list of the foods that you eat. And let's go over the foods that you actually are, allergic to, or and eliminate them. And then eventually we can reintroduce one by one and see which one and what's the severity. And also you can make modifications with the gluten-free now. So there's a lot of gluten-free products. So again, you can modify their diet based on the allergies that they do have.
So it's mainly like a modified elimination diet, right?
Exactly.
Where the first thing is like wheat, dairy, and some of these products. Then there's a comprehensive elimination diet where you kind of what you said, and you and I talked about this earlier. You kind of eliminate everything, and then you just add one thing at a time.
Exactly.
You like eliminate and up to maybe one food, which is generally we start with like rice because we know that that's usually hypoallergenic. Although gluten is now being added in rice, so you have to be really careful. So a lot of times I think it's important for people to realize that soy is not soy, rice is not rice. And because a lot of times we're now genetically modifying foods. I remember my professor, he was my mentor, and he told me, he says, Naina, if you modify an apple, but it looks like an apple, is it an apple? And I had to do a whole talk on that. And I said, no, it's not. You change the molecular structure. And that's just like with anything. Anytime you change arrangements of atoms and things like that, it's no longer that same thing. So we are genetically modifying foods. Right.
And actually I wanted to ask you, what do you think about like diseases such as cancers with the GMOs?
Well, I think everything has to be taken in context. So if you have a person that's having multiple insults, okay, or that they were maybe predisposed to gut issues, and now you're introducing genetically modified foods, we're now finding out that it's getting into sometimes the biome. And we're finding out there's little bits of even the viruses and the bacteria and even these genetically modified foods. There's so much interaction with our own biome in the gut. We know, for example, we have 60% of the gut has what we call the gut-associated lymphoid tissue, which is your immune system. Okay, so I don't know, what is your opinion on, what do you think personally on GMO foods? Are you concerned? If you knew, if you knew, let's say, a food was genetically modified, would you take it?
I'm actually avoiding those.
So how do people look you up?
It's www.bhdietitian.com.
And where is it like, are you working now, 5 days a week, or how does your schedule go?
So I work in the clinical setting, and then I have my outpatient referrals.
Practice,
So
yeah, very nice.
Yeah.
And what's one piece I didn't get into asking of how you take care of yourself? Tell me the top 3 foods to eat and the top 3 foods not to eat. We're almost done.
Okay. Top 3 foods, number 1, water. I think hydration is very important. And being Mediterranean background, I think the Mediterranean diet, so fruits and vegetables.
Perfect, okay.
I think are very important.
So, number 2, okay.
Yes. And then number 3, healthy fats from,
like avocados and seeds.
Exactly. And obviously fish, omega-3s. And the foods not to eat, obviously processed foods, and the genetically modified foods that we discussed, and all the drinks, the sugary drinks. That's the first thing I tell my clients. One of the first things to eliminate is all the sugary drinks.
With all the fructose and all this.
Exactly.
Doesn't matter, right? Doesn't matter if it's fructose, sucralose, whatever. Just eliminate it, you guys. We heard it. So let's see. We hope you get healthier just by having listened to our show. And we'll be back next week with an amazing show at NainaMD, Fusion of Science and Beauty, right here in Beverly Hills. Thank you, everyone, for watching.